Hello.
You're welcome.
Hello.
I'm Meshkat, and I'm a member of the FIP Young Pharmacist Group Publication Committee. I'm doing the interview today, and it's very nice to meet you, James.
Very nice to meet you, Meshkat. Thank you so much.
Again, thank you very much for accepting our invitation. And the theme of this interview is the transition from pharmacy school into practice as lessons from yester-years. And today we are hosting a very honorable guest, Mr. Jaime Acosta-Gomez. And please go ahead, introduce yourself, and give us your consent for recording this interview.
Yes, of course. Thank you. First thing, thank you, Meshkat and Emily, for having me. It's my pleasure. I love to be engaged with young pharmacists, and this is a very good opportunity for me to engage with you. So my name is Jaime, if you prefer. I'm a practicing community pharmacist and pharmacy owner from Madrid in Spain. And I'm very honored to be the current community pharmacy section of the FIP professional secretary. And I have the honor also to co-chair the FIP Technology Advisory Group of the FIP.
Great, thank you very much. And would you please give us a brief background of your education and how did you pass through this into your professional career?
Yeah, sure. So first thing, which I think is very important, both of my parents are community pharmacists. My dad still practices and owns his own pharmacy. My mom retired like 2 years ago. So I grew up in a pharmacy. So it was very natural for me to, of course, study pharmacy and become a pharmacist. After all the years of getting used to the conversations, the human engagement, which is very strong in community pharmacies, and the smells, the activities, it was very natural for me to study pharmacy. So I entered in the Madrid Complutense University, which is a public university. I loved studying pharmacy. It wasn't easy sometimes, very hard with the chemistry especially, and organic chemistry and pharmacognosy, which I hated. But all the rest, I loved it. Yeah, I loved studying pharmacy. It's so complete and so different, and it's I mean, full scope on health, human health, and also veterinary health, with a big touch, of course, of chemistry and medicines, and I loved it. So when I finished my pharmacy studies and I started to practice, I felt that there was something missing. So I studied a master's in the University of Granada in pharmaceutical care, to be more to be a better tool for my patients to improve the outcomes that they were having, especially but not only by receiving medicines. And then I got engaged with Linda Strand and Bob Cipolli, and went to Minnesota in the U.S. To know a little bit more about pharmaceutical care. So that's more or less my. And then I've been doing some postgraduate business courses on prestigious business schools, because that's another. I think that in pharmacy studies, in my opinion, we are lacking first thing clinical knowledge and how to apply all that very important scientific knowledge that we acquire in the university. But we need to be better educated in the sense of using that on behalf of the patients for the benefit. And also we're lacking, especially for community pharmacy practice, ownership, education, knowledge on business, how to run a business. So I've been studying after finishing pharmacy on those two fields.
All right, thank you very much. And how long have you been in FIP And have you ever been a part of a FIP Young Pharmacist group? If yes, how was the experience?
Yeah, so I was involved for the first time at the Centennial Conference in 2012 in Amsterdam. That was a long time ago. And I remember at that time I was representing pharmacy regionally in Madrid. I was the representative of the owners, pharmacy owners in the Madrid Association, which was a big responsibility. And I remember going to for the first time to the FIP, and I was like sun blinded with the level of the discussions. It was very professional and very advanced to what I was used to in Madrid at that time. And also not only the level of the discussions, but the kind of people that attended, that normally attend FIP, who are pharmacy leaders in very different fields, of course, practice, not only community pharmacy, but hospital, industry, academia, science, and education. And it gave me the chance of talking personally with them, the people that are shaping the evolution of pharmacy and are really pushing pharmacy forward in their home countries and internationally. It was a very, very, very good. It has been a very enriching experience from the very beginning. Regarding the early career pharmaceutical group, I remember I was the first time I knew about FIP. I was very interested at that time. It was called the Young Pharmacist Group, and I sent my nomination to be president. I'm very bold, but I must admit that I did not get the guidelines right, and I could not because I was for a few months older than the required age. Of course, I was not that young at that time for a few months. But yeah, I wanted to be really involved with them, but I couldn't. So I went straight to the community pharmacy section, which has been great.
Great, very great story. Thank you very much. And if you want to say like a very important achievement in your background or in current position in FIP, what was the turning point of your career?
Well, first thing, my super big change came before getting into the FIP by volunteering to be part of the program committee at the Inpharma conference, which is both a fair and a congress related to pharmacy, of course. I was at that time just owning my pharmacy for maybe 3 years, more or less. So I was pretty young at that time. And I got involved, and by volunteering, they accepted me, and that changed my life because from that on, apart from practicing in my pharmacy, which is my most important activity, I've been engaged with different positions representing pharmacy regionally, nationally, and now at the FIP internationally. So that was my biggest changing point, just by volunteering for that and getting involved with professional representation of pharmacy, which I've been trying to do since then, trying to improve the role that pharmacists, especially community pharmacists, provide in the healthcare ecosystem.
Interesting, very interesting. Thank you for sharing. And if we want to talk about this section, we want to talk about the challenges. As early career pharmacists, many of us face challenges in work environment. And did you have any challenges? What did you find to be challenging as an early career pharmacist, and how did you overcome it?
It's a very good question. So first thing, I was privileged because my parents own pharmacy, so it was very easy for me to start practicing as a pharmacist once I finished my study, which is not that common. From what I see in my pharmacy, despite that there's a shortage of pharmacists, I would say globally, but for sure in Spain. At that time, I had the chance of starting practicing straight away after finishing my pharmacy studies. So the biggest challenge that I found was that I, I, I had a very solid and big knowledge about medicines and about biology and how illnesses, but I couldn't channel that well when I finished. So I remember the first days, I admitted hiding behind a very experienced technician, because at that time we didn't have electronic prescriptions in pharmacies, which I was part of the development in Madrid. It was a very big time for me, trying to change from paper prescriptions to electronic prescriptions in more than 3,000 pharmacies, and I was in charge of that project. It was a great time, very challenging, but a very great time. So in that time, people came to our pharmacies with paper prescriptions in their hands. So if I saw that they were not bringing a paper prescription, I kind of had hid behind the technician, because they needed to talk with someone. So I was just listening, and that's something that is a very, it's a symptom of, again, that the clinical knowledge that we have after finishing our studies in Spain, at least at that time, and I'm afraid it has not changed that much. It has improved, but not enough, in my opinion. We need to improve that in the pharmacy studies. I mean, it's of course you need to have practice that cannot be given even if you have internships, or it's mandatory to go to pharmacies or community pharmacies or hospital pharmacies or primary care settings. But it was very challenging for me to not be able to channel that knowledge straight away for patients. So first thing, I needed to have some practice, which came. It was just a matter of time. But also, as I said, trying to improve the clinical knowledge that I have, communication skills, which is very, very important. I thought that's been a change for me. I was very proud when I finished my pharmacy studies of all my knowledge: pharmacodynamics, pharmacology, chemistry, everything, physiology. I knew everything. But at that time, I thought that I knew better than patients, and that has changed completely. It's now patients that command me, and I'm just a tool in their hands to try to get for them the outcomes that they want. That sometimes can be very surprising. Sometimes you are surprised of what people want to get from their drugs. Sometimes it's just when having an inhaler is just walking with their grandkids, or sometimes just be able to make a trip. I mean, you just have to listen and try with the therapy that you have in your hands that patients are using. Try to make that happen. Of course, with efficacy and safety perspective always. But that has changed, and now I think that the most important part of our knowledge is the soft skills that we have. It's communication, empathy, sympathy. It's being nice to patients. That's super important. That really gets the patients to receive the message that you are giving them. And we are the champions. Pharmacists are the champions of that. We are very close to patients, open always. So that's that. Now that I talk about it, that has been a change in how I see pharmacy practice.
Right. So if I want to recap what you said, the most challenging part was the communication skills and how to
clinical skills. Yeah.
And yeah. Right. Thank you very much. And now let's talk about the part you are doing in FIP, the digital health and health technologies. I watched a presentation by you yesterday, and it was very informative. And can you explain more about digital health and technologies, on how did that impact community pharmacies? And how do you find it? Is it important for early career pharmacists to develop skills in that field, and how should they do that?
Yeah, so digital health, first thing is here. It's not the future anymore, and you, especially as young pharmacists, know that much better than I do. But it's a very important tool that we cannot put aside. It's going to change how healthcare is being provided, is changing it already. I was saying this morning, and I tweeted about it, that a region in Spain is going to develop a tool, an artificial intelligence tool that is going to red flag potential problems with patients. And if we do not incorporate those kinds of tools in the pharmacy practice, we will be out of the healthcare ecosystem. So first thing, we need to be educated about it. Most importantly, we need to be aware of its importance and the potential that it has to keep changing the way pharmacy is going to be practiced. And we need to adapt and hopefully to lead the change that digital health is bringing in many senses. So first thing, which I would say is not the most important, is how the business is being done. It brings technology brings many opportunities to automatize, improve the quality, and provide more efficient business operations. But the part of the clinical practice is going to change so much that we need to really incorporate that and try to adapt, as it happened with pharmacy before many times.
Thank you. And what do you think is the added value of involving early career pharmacists in this field? If speaking about these innovations and as you said, it's the present, it's not the future anymore. How can we as early career pharmacists lead this innovation? And how can be an added value to all these changing environments?
So you are very valuable in that sense because you have the passion and the given knowledge. You are used to technology, while, for example, my kids know that I did not have a mobile phone for a while, and they cannot understand how I could survive without a mobile phone, and many more examples. So you are digital natives, and it's very natural for you. That's very important added value with the passion that you bring to try to change and improve things. That's very important. Also, there's professional pathways related to technology, not only by practicing with digital health tools, which of course, I mean, everyone understands it, but also supporting the development of digital health technology. There's a very important place for clinicians in digital health companies, because as part of a multidisciplinary team with, of course, IT people, lawyers, business people, there's a very important place for clinicians who really need to lead the development of these tools for the benefit of patients. So you need to be bold and be curious and keep being passionate, and try to change how pharmacy studies are being delivered. Because also one thing that we found in the FIP with digital health in pharmacy education report, which was published I think around 2 years ago, we found that things have been improved, but at that time we saw that digital health was almost non-existent in pharmacy curricula, postgraduate pharmacy curricula, and we need to change that. And your support there and you pushing for that is very important too.
Great, thank you. Very important suggestion, and pointing that is very important for early career to go ahead and advocate for such things. Do you have any topic in your mind, like any concern in your mind that you think is the most important thing that early career pharmacists should get involved?
Well, I think more globally, it's very important that you push for change. You are the practitioners, not only for now, but for the next 30, 40 years. And the profession really needs you to push and advocate for change and adaptation. There are some colleagues of us who think they don't say it like this, but they want to keep practicing as our grandparents did. and that's simply impossible in many senses. Not only because of digital health, that of course for that, but in the sense of changing from in community pharmacy from a dispensing model to try to focus more on services and trying to improve health with many different potential services. We really need to change how pharmacy is being practiced, and change is happening. In some countries, it's faster than in others. So I'm kind of satisfied how the profession is evolving, especially after COVID. But we really need to keep pushing for more and never stop. We need to keep adapting. Otherwise, again, the profession will be finished. And if it's finished, it would be for the good because we couldn't adapt. So I hope that my children will be able to practice pharmacy in the future. And for that sense, we need you guys to keep pushing and advocate and do the excellent work that the ECPG is doing, for example, but in many other associations, not only internationally, also in the students setting, nationally, regionally, and internationally. So we really need you to keep pushing.
Great, thank you very much. And would you please give us a piece of advice for a take-home message for all of us? And if there is anything else that you would like us to hear from you, please go ahead, and the floor is yours.
Thank you. So this is not an advice. You know much better than me that what you should do. But in my experience, what worked, I had like three phases in my three different steps in my professional career. Always, first thing, I volunteered for everything that I liked. I volunteered and pushed to be incorporated and accepted in different places. For example, that conference thing that I told you about, which was the biggest change in my career. Second thing, once they got to see how I worked and sometimes liked the outputs, the outcomes that I brought, they started to offer me things that I always say yes to everything. Yes, everything that I was offered, I said yes. No matter if it was a small task. But I think most importantly, I said yes always to things that I thought that I could not be able to deliver, because I finally delivered. And it was the people that were offering me those things that thought that I could deliver. So I trusted them and said yes always. It wasn't easy always, but I think that worked for me. And now I'm trying to say no to things because I don't have the time to for that for all the things that I'm offered. So that's been difficult for me because I'm very enthusiastic. I think I'm very enthusiastic, and I like to be engaged with different things. But I really do not have the time to work properly when I do so many things, and I don't like to not be able to deliver with good quality. So I'm trying to say no to some things and try to focus on two aspects. First thing, things that I like, and second thing, things that I can bring an added value to the things that I do. So that's my experience. Always volunteer, then you will have a time when you will be offered things. You have to say yes to everything, and then try to be more focused on the things that you do by saying no to some things, sadly.
Great, thank you very much. And the last question, how can early career pharmacists engage with the community section of FIP and be in touch with you if they have any issue in their mind? And how can actually FIP benefit pharmacists all around the world from its activities in this section?
So thank you. So the community pharmacy section supports the development of community pharmacists worldwide. I think we can be proud of the work that the CPS is doing, trying to improve. Especially, we've had a very recent project about professional well-being in community pharmacies. There's sadly a lot of burnout and sometimes mental health issues with the profession globally. Also, the shortages of pharmacists that has to do with the working environment that we have in community pharmacies. So we run, I think, a good quality research with under the leadership of Dr. Dineen Griffin and Mr. Connolly from Australia and Ireland. We're trying to develop that a little bit further with more resources from the community pharmacy section. But answering your question, there's a structure in place. We are ECPG liaison is Andrea Pablido. Also with the support of Gonzalo Atsuan, who's from Spain. Andrea is a Greek early career pharmacist who's studying in London. So I think that would be the natural approach for ECPG members to engage with Gonzalo and or Andrea. And that's the right way to go. Anyway, if they want to reach me directly, I'm fully available on social media, LinkedIn, Twitter, and Facebook, and I'm fully available for them.
Great. Thank you very much for your time and for all the great experience you shared with us. And if there is anything else to say, please.
One last thing, congratulations to the ECPG. It's always a pleasure to work with you also because your work is super professional, always very easy to work with. Very well done.
Thank you. Thank you very much. And thank you everyone for being part of this session. And I hope you find our newsletter engaging and interesting.